I got introduced to possibly becoming a CRNA when I was an L&D nurse back at a small Texas hospital, and I found one doing an epidural, and I became curious about exploring the advanced practice nurse profession. So in order to do that, I started asking around about different CRNA programs. As soon as I walked in the doors of the University of Maryland, I was like, this is for me. And I moved the day I was accepted and started the program because I was ready to go.
The primary responsibility of the University of Maryland School of Nursing Nurse Anesthesia program is to provide a critical access service of anesthesia. There's about a 19% shortage of nurse anesthesia providers within the urban centers. There's about a 38% shortage within the rural centers.
CRNAs are also the primary provider in rural areas of America. This allows medically underserved communities to get access to obstetrical services and surgical services that hospitals may otherwise not have been able to provide to their patients.
During didactic, before we actually started our hands-on clinical rotation, I mentioned that I was interested in doing regional anesthesia, which is peripheral nerve blocks and things like that. I eventually want to open my own pain management clinic. The way that our clinical experience works, we get a primary site originally. So we stay at this primary site for 6 months. My primary site was Sinai. I was able to do regional anesthesia, orthopedics. I was able to do obstetrics. I was able to do neuro. I was able to observe a couple of heart cases. I feel like my primary site really helped me develop the foundation that I needed.
They have state-of-the-art simulation at the school that really prepares them for entry into our operating rooms. And they get clinical experience in an academic medical center that many schools don't provide to their students. The students get exposed to high acuity types of surgeries that they wouldn't see anywhere else.
Diversity is very important to me. I like to be a part of a program where I feel like other people would understand the type of struggle that I would go through being the person that I am. Also, you get exposed to different cultures and things like that, and everyone learns differently.
We are the most diverse program in the country for nurse anesthesia. They benefit because of the fact that they're in class with so many different cultures, so many different ethnicities, so many different points of view. And these different points of view then equate to giving better patient care because that's our patient population.
I feel like this program makes you so independent. As soon as you graduate and pass your boards, you're ready to become a CRNA. This program really prepares you to practice autonomously.